we turn to 500 Health now and taking control of your cancer risk, there is new evidence that links the choices that we make to at least 40% of new cancer cases among Americans 30 and older. That is a significant number of people, 40%. Dr. Todd Eller is with us right now, Deputy Chair of Medicine at South Shore Health. That number gets my attention. So it's easier, right, to blame cancer on what? Bad luck or bad genes. You know, my grandfather had it, my father had it, blah, blah, blah. But this new study from the American Cancer Society suggests that we've got a lot more control over cancer risk than we seem so. Is that true?
Eddie, cancer can really take away our power. So what I love about this study from the American Cancer Society is that it empowers us to say that a lot of cancers and cancer deaths have modifiable risk factors. Okay, and you can see the graphic there.
Right.
Lung cancer, breast cancer, melanoma, colorectal. By the way, lung cancer is responsible for 20% of these cancers and 1/3 of these deaths.
But you know, it's not easy to stop smoking, for example. Just as one little application for lung cancer. Not the only one, but I'm just saying.
I'm really glad you said that, because you can see there are things that we can do. Quitting smoking, losing weight, decreasing alcohol, right? Avoiding the sun or using sunscreen. But it's really difficult to quit smoking, right? It's easier, and as we're seeing cancers hit younger people,
right,
we have to really start with our kids to get them so they don't start smoking.
Right.
Because the first time you smoke, that's a choice. But after that, once you become addicted, it's not really a choice anymore. So we have to try to, imbue the right lifestyle changes when they're young.
I know we've already touched on it, but what changes can we make right now, today, at 4:48 in the afternoon? Obviously, we can't rewind the tape, but we can go forward.
Right.
What changes can we make?
Not starting smoking or quitting smoking is the most important one.
Yep.
Okay. Decreasing weight. Believe it or not, being overweight is linked to 13 different types of cancers.
Yeah.
Okay.
Yeah.
And a few other things as well is, believe it or not, like the HPV vaccine.
Yeah.
That's a simple vaccine to
Human
take. It is
papillomavirus,
high correlation to cervical cancer and oral cancers. And if you take that vaccine, you markedly decrease your risk. Other things, again, eating more fruits and vegetables
Right.
than red meat,
Right.
can decrease your risk of colon cancer.
Right.
Eating more fiber can decrease your risk of colon cancer. There are things that we can do. Of course, don't forget screening. That doesn't prevent cancer,
Right.
but remember, breast cancer starting at age 40 every other year. Colon cancer has been reduced starting at age 45.
Right.
There's things that we can do. We can be empowered.
And I'm not oversharing. I've survived cancer through an early detection. So test, screening, and check it out early is going to be beneficial to you. What else? Anything else you can add to it?
I mean, I just think that, you think we all know people who have cancer.
Right.
You've experienced it.
Right.
And I think that there are things that we can do. Let's try to move forward.
Right.
Again, things like obesity. For years we said, just exercise and don't eat as much. That didn't work.
Right.
But now,
Right.
with these injectables, along with healthier diet, exercise, things like that, we're actually seeing that by decreasing weight, it's already been associated with decreases in certain types of cancers. So I think we're going in the right direction.
Dr. T, great to see you.
Good to see you.